Hello, sir. My name is Nick. I'm going to be your nurse today. Can you tell me your full name
Carlos McDonald,
and your date of birth?
5/12/75.
And can you tell me today's date?
April the 21st, 2016.
Excellent. Do you know what this building is
New York Presbyterian, Cornell,
and what city we're in?
New York.
Okay. And how did you get here today?
I drove.
So, based on that, you're alert and oriented to person, place, time, your short-term memory and your long-term memory are intact, and your speech seems to be clear and fluent. Now, what I'm going to ask you to do is stand up for me. Okay. Your posture is good, upright. I'm going to do a Romberg test, so if you could just stand still. We see no swaying. Can you close your eyes now? And the same. It's good. Now what I'm going to do now is called an upper extremity drift. So can you, with your eyes closed, just put your arms out in front of you with palms face down. Good. Now I'm just going to push. Excellent. Now you can open your eyes and put your arms down. That's normal. So what we're going to do now is I'm going to ask you to take your fingertip and touch it to your nose. And down. And the other. Excellent. And I'm going to ask you to take your heel and run it down your opposite shin. And then the other one. And down. Okay. Balance and coordination are intact. Now I'm going to ask you to do a little walking for me. Come over here. This way we can see. I want you to just walk normal, that way. And turn around and walk heel to toe, coming back. Excellent. On that way, please walk on your toes. Excellent. And this way on your heels. Okay, thank you, Carlos. Okay, gait is steady, normal arm sway. Any discomfort?
No.
Okay. So I'm going to do what's called a musculoskeletal assessment. First, I'm going to look at your spine. I'm going to inspect, and on inspection, your spine is straight, no scoliosis noted, no lordosis. I'm going to palpate. Any tenderness?
No.
I don't feel any masses. Skin is clean, dry, warm, no lesions. Now I'm going to ask you to flex the chin to the chest, and then extend and hyperextend. Good. Now we're going to do the whole spine, so if you can flex down to the toes, up, extend, and hyperextend. Good. Any pain, discomfort there?
No.
Okay. Now I'm gonna take a look at your shoulders. Okay. So I'm just gonna look real quick. On inspection, your shoulders are symmetrical in height. Skin was clean, dry, intact, no lesions. Any tenderness?
No.
Okay. No crepitus in the joints. Okay. Now we're gonna do a little range of motion. So what I'd like you to do is flex. You could just follow my movements, and I'm going to say what it is we're doing. So flex, extend, hyperextend if you can. Good. Okay, at your side, we're going to adduct, and then, I'm sorry, this is abduction, and then adduction, if you could cross. Okay, good. Then we're going to do, with your elbows at 90 degrees, we're going to do external rotation and internal rotation. Okay. Also going to do what's called a drop test. So what I'd like you to do is close your eyes, lift one arm up. I'm going to support your arm, and then I'm going to let go, but try to hold your arm up. Good. You can put this arm down, and we're going to do the other side. Excellent. Okay, you could open your eyes. Okay, now, next thing, we're going to do your elbows. I would like you to, I'm going to inspect. No nodules, no lesions. I'm going to just palpate, no crepitus, any tenderness?
No.
No masses palpated. I'm going to do, now just follow me, we're going to do flexion, extension, hyperextension. Okay. Now I would like you to do supination, pronation. Excellent. And we're going to go to your wrists, looking at the wrists now, wrists and hands. Okay. So what I'm looking for here, same as the other ones, any tenderness?
No.
Okay. I don't see any clubbing or edema. There's no induration, no cyanosis. I'm going to ask you to flex and extend, hyperextend. Okay. And we're going to do ulnar deviation, radial deviation. Good. Okay. Now I'm going to ask you to come up like this. Okay. Now what I'm looking for here is the metacarpal phalangeal, the proximal interphalangeal, and the distal interphalangeal. So I'm going to palpate these. Any pain or tenderness?
No.
No nodules felt. Okay. And overall, the upper extremities, the skin is, like I've been saying, is clean, dry, it's intact, flexible, good elastic recoil, immediately recoils, and excellent. I'm going to go back to the spine just real quick. I did forget to do something. I want you to do lateral bend, and then the other side. Good. And then I would like you to rotate one way and then the other. Okay. Excellent range of motion in the spine, in the shoulders, the elbows, in the wrists, and all the fingers. Now I'm going to just check your hip. This is just going to be a quick one. We're going to do extension of the hip and hyperextension. Okay, good. You could take a step forward to your head so you have some room. And then the other one. Extension and hyperextension. Good. I'm just going to touch. I'm going to palpate. Okay. And then I'm going to ask you to sit. Okay. I'm going to check your ankles and your feet. Okay. So the first thing, and as long as we're here, we're looking at the legs. No cyanosis, no clubbing, no induration. Skin is clean, dry, intact. Skin is warm. So on the feet, any tenderness?
No.
No crepitus, no masses. Okay. So now I'd like you to do plantar flexion, which is pointing toes down, dorsiflexion. Okay. And what I would like you to do is external rotation and internal rotation. Good. And on the feet, similar to the hands, we're looking at metatarsal phalangeal, proximal interphalangeal, and distal. Okay. Any pain, tenderness?
No.
Okay. And no nodes felt there. Doing okay so far? Okay. Range of motion is good. I'm going to just test your strength really quick, so we can do that while you're sitting down. And that's going to be hold your arms straight out. And I would like you to flex up, flex down. Okay. Push out, abduction, and then adduction. Good. We're going to do the elbows now. So if you could bend, flexion, extension. Good. And then the same thing on the legs. Push to my resistance, and back, and then on my feet, on your feet. Good. Okay. Strength is great. 5 out of 5. Everything's normal there. Okay. Now I'm going to test your sensory. Okay. What I'd like you to do is tell me if what you feel is sharp or dull. Okay, so close your eyes for me. I'm going to test on your hands and on your feet.
Sharp. Dull.
So that was light. I'm going to do it again, and it's going to be deeper. Okay?
Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull.
Excellent. Thank you. I'm going to place an object in your hand with your eyes closed, and we're testing stereognosis. Okay? So, can you tell me what this is?
A key.
Yep, that's what it is. Thank you. Okay. And then I'm going to check your deep tendon reflexes. Okay? I'm going to start on the right, then I'll move over to the left. We're going to do all of these here. We're going to do brachial. And what we're looking for is just the contraction in the, the bicep tendon. We're going to look for the contraction there. Good, right there. That's what we want. We want the brachioradialis is here. Good. We're going to do tricep. Good. We see the contraction in the tricep. We're going to do patellar on the knee. The Achilles on the ankle. Good. And then a Babinski reflex on the foot. Good. And we're going to do the same thing on your left side. I'm going to start with brachial. Sorry, bicep. Good. Brachioradialis. Tricep. Try one more time. There it is. Okay. Achilles. Patellar is here. Achilles is down here. And Babinski. Good. Okay. Now, what I would like to do is we're going to test, I'm going to start cranial nerve number 1, and that's olfactory nerve. Okay? So, what I want you to do is give this a smell for me and tell me what you think it smells like.
Vinegar.
Good. Sorry if it was unpleasant. I'm going to test the patency of each nair. I'm going to cover one and then just breathe in the other one. Good. Excellent. Any tenderness here?
No.
Okay. The maxillary and frontal sinuses, any pain there?
No.
I'm going to take a look as well. Nose is at midline, everything's symmetrical. Okay. So what I'm going to do is I'm just going to insert the tip and lift up. Tell me if there's any pain, tenderness.
No.
I'm going to take a look inside. Okay. Septum is not deviated. There's no perforation. Mucosa is pink. No excessive mucus. No polyps. Okay. I'm going to test cranial nerve number 2. Okay. Cranial nerve number 2 is for your eyes. We're going to test with confrontation. Okay, so cover one eye, please, and tell me when you see my wiggling fingers come into your peripheral vision.
Okay.
Sorry. What I want you to do is look right at my nose.
No.
Good.
No. No.
And then the other one.
No. No. No.
Excellent. Okay. Now we're also going to do cranial nerve 3, 4, and 6. Okay, and this is for extraocular movement. So what I want you to do with both eyes, just with your eyes, follow my pen. Okay. And here we're doing the cardinal fields of gaze. We don't see any nystagmus, no lid lag, and then we see confrontation of the eyes, and accommodation of the pupils when we're there. Now, if you can you cover one eye and read the lowest line of this Snellen chart?
DEFPOTEC.
Excellent. And then the other one?
DEFPOTEC.
Excellent. It's 20/20 in both eyes without glasses. So now I'm going to test for your pupillary light reflex. So this is direct. We're looking at the eye that I'm shining the light in. And the pupils are constricting. Then consensual, what we're looking for here. So I'm going to shine the light in, and we're looking at the other pupil. And we see the other pupil constricts as well. Excellent. Good. Now I'm going to do a fundoscopic exam. Dim the lights just a tiny bit, not too much for the camera to not see us. I'm going to start on this side. Now just looking straight ahead, on the outside of the eye, the eyelids are even. I'm sorry, the eyebrows are even, at the same height. The eyelids are, actually, let me get the lights up. The eyelids are even, there's no ptosis. The conjunctiva, the palpebral conjunctiva, and the bulbar conjunctiva is on the eye itself. No hemorrhages, no redness, everything looks good. Then we have the lacrimal system, there's no discharge. We see the medial and lateral canthus on both eyes, both are intact, no lesions there. The cornea is clear, the sclera is clear, no opacities seen in the eye, no lesions to the eye. The irises are both dark brown, and the pupils are about 3 millimeters in both eyes bilaterally. So now I'm going to do the fundoscopic. Sorry for that delay. Okay. Looking straight ahead, I'm going to shine some light in your eyes. Pardon me. Okay. Sorry about that. Okay. What we're looking for is red reflex in the eye, which we can see. We see the retinal vessels, the arteries, and the veins. No AV nicking, no hemorrhages, no aneurysms. I'm going to come in a little closer. Okay. We see the cone of light, which is medial, the cup to disc ratio. I'm sorry, not the cone of light. We see the cup, and the cup to disc ratio is 1 to 3. Then if you can look at the light, and we can visualize the macula. And then I'm going to do the same on the other side. Okay, red reflex, we see no AV nicking. We see the cup with the arteries, all the vessels converging there. Cup to disc ratio is 1 to 3. If you could look at the light. Okay, and we see the macula. Excellent. Okay. I'm going to bring up the light. Good. Now what I'd like to do is cranial nerve number 5. And what I'm going to do is I'm going to take some cotton and I'm going to touch your face with it. So I'd like you to close your eyes. Let me know when you feel the cotton on your face. you could open your eyes. Okay. And while we're here, we see the head is normocephalous, size, normocephalous, shape is round, no masses or lesions, hair is equally distributed, hair is soft. I'm gonna palpate. Any tenderness?
No.
I'm gonna palpate your temporal arteries. Pulsations are normal. 3. Okay. And then your TMJ joint. Can you bite down? Okay. Open. And then open to my resistance. Excellent. Okay. So I'm going to now move to cranial nerve number 7. Now number 7, this is also on your face. I'd like you to lift your eyebrows. Good. Can you frown for me? Can you smile? Okay, and puff out your cheeks. Excellent, thank you. Next is going to be cranial nerve. We're going to skip cranial nerve number 8. We're going to go to 9 and 10. 9 and 10, I'm going to have to look in your mouth. Can you open? Stick out your tongue and say ah. Okay, good. And there we see the soft palate and the uvula, the epiglottis raise up. Excellent. Okay. Cranial nerve number 11 is I'm going to place my hands on your shoulders and shrug your shoulders to my resistance. Good. Look left to my resistance. Turn your head right to my resistance. Excellent. Cranial nerve number 12, I'm going to ask you to stick out your tongue all the way out and move it up to right. Excellent. Okay. Sticking with the mouth, I'm going to do a mouth exam. On the outside, we see that the lips are pink, no drooling, no lesions. I'm going to ask you to open your mouth. No halitosis. Your buccal mucosa is pink. Teeth are intact, they're all there. Gums are pink, there's no bleeding. The tongue is pink underneath the tongue. Good, I don't even have to help you. That looks great. Pink, I'm gonna take a look at your hard palate, which is pink, no lesions, and soft palate looks good. And I could also see the tonsils, no exudate, no scarring or lesions there either. We're going to grade those grade 1. Okay. Now I'm going to do cranial nerve 8. Okay. And cranial nerve 8 is going to involve a whisper test. So I'm going to cover one ear, and I'm going to whisper something in the opposite ear, the one that's open. You're going to tell me what I said.
1, 2, 3.
Good. And the opposite?
1, 2, 3.
Good. Okay. Now I'm going to do what's called a Rinna. I'm sorry, I'm going to start with a Weber test. Just tell me if you can hear the sound in one ear better than the other, or if both ears equally.
I'm in sound in both ears.
Good. Now we're going to do the Rinna test. So just tell me when you do not hear the sound anymore. Okay, I'm going to do it twice in both ears. Just tell me when you stop hearing the sound.
Okay. Okay.
Good. AC is greater than BC.
Okay. Okay.
Now I'm going to inspect the ears. The ears are even, they're symmetrical, they're clean bilaterally, no scarring or lesions. I'm gonna palpate your mastoid process. Any tenderness?
No.
I'm gonna push in on the tragus. Any tenderness?
No.
Okay. I'm gonna do an exam inside your ears. Okay. The auricle is clear. I'm gonna pull up and back. The canal is clean, no cerumen, no erythema. I can see the tympanic membrane. The cone of light is on the left side, and this is the left ear, so that's great. That's where we want it. No perforation, no scarring. I can visualize the malleus and the pars flaccida. Looking good. Doing okay, Carlos?
Yeah.
Excellent. Same on this side. I'm going to pull up and back. The ear canal is clean, no cerumen. I see all the way to the tympanic membrane. The cone of light is on the right, and this is the right ear, so that's exactly where it should be. I can visualize the malleus and the pars flaccida. No scarring or perforation on the tympanic membrane. Before I did, I asked you to tell me if you felt sharp or dull.
Yes.
Now I'd like you to just hold out your hands. I'm going to test just for vibration. If you tell me when you feel the vibration. So close your eyes.
Yes.
Good.
Yes.
Good.
Yes. Yes.
Good. Okay. Now I'm going to look at your neck. Neck looks good. The trachea is at the midline. The skin looks good. The skin is warm. No abnormal pulsations, no distensions. I'm going to palpate your trachea and the thyroid. Okay. And I'm also going to feel, I'm going to palpate for your lymph nodes. Sorry. I was going to say for your tonsils, but I'm not going to palpate your tonsils, so I'm going to palpate your lymph nodes. Okay. Preauricular, postauricular, tonsillary, occipital, tonsillary again, submandibular, submental, superficial cervical, posterior cervical. Can you look that way for me? Deep cervical, and this way. Deep cervical on this side. Good. Straight ahead. Supraclavicular. Okay. And the cervical spine, any tenderness there?
No.
Okay. Hang in there. So now I'm going to assess your lungs. So I'm going to ask you to flip around. If you can take the gown down. Now the spine, again, is straight. Skin is clean, dry, intact. No skin abnormalities. The breathing rate is regular. No accessory muscles visualized. No retractions or bulging. Okay. When you feel my hands on you, I'm going to ask that you, any tenderness?
No.
I'm going to ask that you say the word 99 every time you hear my hands. Every time you feel my hands.
99, 99, 99, 99.
Okay. Tactile fremitus is good. I'm going to take a listen. So if you can just take a deep breath every time you feel the stethoscope. We heard tracheal sounds towards the top. We heard bronchovesicular sounds in between the scapula and vesicular sounds everywhere else. I'm going to do whispered pectoriloquy. So just say, whisper the word 99. Good. And then we're going to test for egophony. So say E each time. Excellent. Okay. I'm also going to test your diaphragmatic excursion. First, I'm going to percuss. Okay. Take a deep breath in for me. Okay, that's right here. Okay, and out, all the way out. Okay, and you can breathe normal. And that is about 3.5 centimeters, 4 centimeters, 4 centimeters. Good. I'm going to test for chest expansion. So I'm going to grip onto you, and I'd like to take deep breath in. Good. And we feel we feel the hands moving outward and the thumbs moving outward as well. And then I'm going to test for your CVA tenderness. So I'm going to tap toward the kidneys. Any tenderness?
No.
Okay, excellent. I'm going to take a look at the front. So if you could come this way for me, this way. We have a good angle towards the camera. We'll do the same thing that we did on the back, just on the front. Okay. So skin is clean, dry, intact. We're going to palpate for any tenderness. Also, we don't see any bulgings or retractions, no labored breathing, no accessory muscles being used. Breathing rate is normal. Okay, tactile firmness. Say 99 for me.
99, 99, 99, 99.
Okay. You're gonna do whispered pectoriloquy. So just set a whisper 99. 99, 99, 99, 99, 99, 99, 99. Okay. And egophony. So E.
E, 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 E.
Okay. Now you could just breathe normal. Or with just deep breaths in, please. In, out. In, out. Excellent. So for egophony, when you were saying E, I didn't hear any muffling. It sounded just like E. It didn't sound like A. That's exactly what we want. Okay. I'm going to check cardiac. I'm going to do a cardiac assessment. So I'm going to check the blood pressure. Good. 104/78. I'm going to check the radial pulse. It's about 72 beats per minute. I'm going to do pulse deficit at the point of maximum impulse here, radial, and no deficit. I'm just going to take a listen. Well, first I'm going to palpate. Aortic, pulmonic, tricuspid, mitral. I'm going to listen with the diaphragm and the bell. Excellent. I'm going to ask you to lean back. Okay. I'm going to palpate at each of the 4 landmarks. No heaves or thrills visible. No heaves or thrills palpable. I'm going to take a listen again on each of those points. Diaphragm of aortic, pulmonic, tricuspid, mitral. Now with the bell, aortic, pulmonic, tricuspid, mitral. Good. Carotid arteries, we see pulsations, no jugular venous distension. I'm going to take a listen for Burley. No brewing. And I'm going to palpate the carotids. Good. I'm going to do just a quick vascular, peripheral vascular assessment. Again, no clubbing, cyanosis, no edema. I'll test the radial pulse, brachial pulses, femoral pulses, dorsalis pedis, and posterior tibial. Excellent. Thank you. And those are all good at +3. I'm going to do a abdominal assessment. And we're almost done. Lift this up. Okay. So abdomen is flat, non-distended. We see a little bit of aortic pulsations, which is normal. Skin is clean, dry, intact, and warm. I'm going to take a listen in all 4 quadrants with the diaphragm for bowel sounds. It's normal, normal, normal. And then with the bell for Grui, over aortic, and then renal. Good. Now I'm going to percuss. And we hear the tympani, which is what we want. I'm going to percuss for your liver. Excellent. I'm going to check the borders of your liver. I'm listening for resonant of the lungs to dull. At the midclavicular line, so we're here. And then the change from dull to tympanic here. And then the midclavicular line, same. Here. And what we're measuring here, we have 8 centimeters midclavicular and 5 centimeters midsternal. Okay, now I'm going to palpate, if that's okay. Light palpation, no guarding. And then deep palpation. pain?
No.
We can palpate the liver. I'm going to palpate for the spleen and ask you to roll onto your side, facing that way. Okay. Palpate for the spleen, which we do not feel. I'm going to percuss for the spleen. Deep inhale. Okay, and then a deep exhale. And what we find is that they're about in the same spot. Yep, change from resonant to dull. Excellent. Thank you very much. Lay back down, and then quickly for the hips, we're going to flex the hip. Okay, and then we're going to abduct the hip, and adduct the hip. Good, full range of motion. And on the other leg, flex, abduct, adduct. Can you do internal rotation and external rotation? Good. And then flex of the knee and extend of the knee. Good. Full range of motion. Strength is good. And then we're going to flex the knee. Internal rotation of the hip. External rotation of the hip. And extension. Okay. That's it. Thank you, Carlos.
Thank you.